Why did come to you? What exactly was his problem?
Sir, he had come to me with pain in the left shoulder, and the pain was so severe that he was not able to move the left shoulder, and even tapping on the shoulder itself is very painful for him. Even simple tapping is very painful for him, and he has been suffering from this problem for about 6 months, and the pain has been gradually increasing with no relief, in spite of him attending many doctors. In spite of that, there was no significant relief for him. So he was referred to me by a known doctor, and then on examination and on seeing the MRIs, I found out a tumor very close to which was enhancing with contrast, and which was very close to the axillary nerve in the left shoulder. So I was prepared in my mind that the tumor has to be excised because it's causing pressure symptoms, and the axillary nerve is getting compressed. So I planned for excision, but I was very skeptical that the axillary nerve may get damaged because on the MRI films which I received, I saw that the tumor was pretty close to the axillary nerve, and in some films it appeared as though the tumor was coming from the axillary nerve itself. So then I asked my friend Dr. Balchandra, who is a plastic surgeon, to have a look to the patient, and what is. So I examined the patient and I found that there is an unbearable pain just by touching the skin. Rarely we can see this type of problem. If any accident happen, if any stab, knife injury, if directly a nerve damage, then only we can see this type of severe pain. But we're surprised to see that there is a small tumor like thing very close to the axillary nerve. So axillary nerve means it's a nerve which is situated in a small space near the shoulder area. When I'm able to move my shoulder up, there will be a lot of pain. The space will come down. So if there is any tumor, it's pressing the nerve, causing unbearable pain. So in my service, rarely 1 to 2% people only I have seen like with severe pain, presenting with severe pain. But this patient, uh, I examined and I correlate my findings with the MRI findings, and we together, Dr. Natesh and myself, we together planned for surgical excision of the tumor. But outside the report came as some tumor, but we will never believe until we send for total resection and for sending biopsy. So we planned for the surgery, we prepared the patient as for the anesthesia, general anesthesia. On the operating day, we counsel the patient what are the possible things. These type of problems come, will evaluate in a 3 to 4 directions. One is this tumor may exist from the birth, or it is increasing slowly, causing problems now, or there may be a cancer type, or there may be infection type. In these 3 ways were evaluated during the operation. So on the operation day, with proper counseling to the father and family members and also to the patient, what's going to happen, what are all the possible problems, and we took the patient inside. Our anesthetist Dr. Raghavendra sir gave anesthesia, and the patient was on the table in prone position. So I explored, I opened the area, and I found that there is a 4 centimeters tumor which is located in between the axillary nerve branches. So this is very rare tumor in this particular age group. This patient is only 19-20 years age group. So usually we can see this type of tumors around 45-50 years age group. So immediately we have a doubt that whether it's a cancer or not. To conclude that, we send the tissue after resection to frozen section. Means we'll get the report within 30 to 40 minutes that whether this is a cancer or not. So if it's a cancer, we'll remove more and more tissue. If it's not a cancer, we'll remove what are all the removal part, that is enough. So surgery went very well. So we completed the surgery in 2 hours with good post-operative recovery. And second and third day post-operative period, we check for the pain. Patient is very comfortable. He lost his previous unbearable pain. Now he is very comfortable for the all shoulder movements without any damage to the nerve.
without any damage to the function of the shoulder. Now the patient is very happy.
We are very happy that we were able to do a perfect surgery with high precision, just removing the nerve, which is very complicatedly placed between the branches of the axillary nerve, wherein without scraping off or damaging any branches of the axillary nerve, and without even injuring the axillary nerve, we were able to remove the tumor. That is a technically skilled procedure that we have performed, and with high precision. And we were even prepared for any eventuality like transposition or cable grafting of some other nerve in the place of the axillary nerve, which by God's grace did not arise, and we were able to remove the tumor in toto. And I'm very thankful for the team. Thank you very much.
मेरे को यहाँ पे लेफ्ट हैंड पे दर्द था, वो दर्द की वजह से कोई अगर टच भी करे तो उससे दर्द देता था। तो जब मैं यहाँ पे आया, डॉक्टर नटेश को बताया था, एंड देन मालूम पड़ा कि वहाँ पे एक छोटा सा गड्ढा बने सो है, एंड उसको निकालना था। डॉक्टर के गाइडेंस में सर्जरी हुई, एंड वो गड्ढा निकल गया, एंड सक्सेसफुली सब हो गया, एंड अभी कोई भी प्रॉब्लम नहीं है, दर्द भी कम है, स्टाफ और भी अच्छा है, हॉस्पिटैलिटी है, एंड सब जने टाइम टू टाइम आ जाते हैं, सब क्लीनलीनेस मेंटेन्ड है, हाइजीन भी प्रॉपरली मेंटेन्ड है, एंड स्टाफ भी बहुत ज़्यादा फ्रेंडली है, एंड टाइम टू टाइम बुलाने पे तब का तब आ जाते, डिलेज और नहीं है। सो ओवरऑल एक्सपीरियंस अच्छा था।
So this is the axillary nerve that's coming, and from here, this is the sensory branch. This is the sensory branch. This is the motor branch.
Tumor is here.
Tumor is removed from this area. So not exactly from the nerve. Only one or two branches mostly are damaged. Now repair is not, grafting is not required.